Everyone has a different opinion on cannabis. Some say it reduces anxiety, some say it causes psychosis. So, what is the truth behind it? This is based on standard references like the conceptual textbook of psychiatry. The main chemical in cannabis is the THC, which is the tetrahydrocannabinol. So the THC acts on the endocannabinoid system, which has two main receptors, the CB1 and the CB2. CB1 receptors are predominantly present inside the brain. The main parts are the hippocampus, which is associated with the memory formation, the basal ganglia and cerebellum, which is associated with movement and coordination, the limbic system, which is associated with our emotions, and lastly, the hypothalamus, which is associated with appetite. And the CB2 receptors are predominantly present in the immune cells and the peripheral tissues, and some receptors are also present inside the brain aspect. Your brain naturally produces endocannabinoids. They act in a regulated, short-lasting way. The THC mimics them and acts in a stronger and a less regulated pathway. So this is what is causing the impaired memory and attention, the increased reaction time, increased appetite, and also the altered mood and perception. The effect starts within minutes and it peaks quickly in your blood. Some people will feel relaxed, happy, or light, but some others feel panicky or they'll become anxious or uncomfortable, mostly if it is their first time or if the dose is too high. And now here's something interesting. Yes, cannabis does have some medicinal values. Those include mild to moderate pain relief, nausea and vomiting in chemotherapy patients, increasing appetite in certain conditions, and some help in epilepsy as well as muscle spasticity. This is the part where most people don't pay attention to. In all these conditions, the use of cannabis is limited, obviously because of its psychotropic effects on the brain. Whether it is pain relief or nausea control or epilepsy, the use of cannabis in all these conditions is limited, and it is not the first line treatment in any of these because of the adverse psychotropic effects as well as better alternatives available today. Here is the most important question. Can cannabis cause schizophrenia? So the answer is, cannabis can trigger schizophrenia in vulnerable individuals or genetically predisposed individuals. The risk increases with early use, frequent use, and the use of a stronger variant. So clearly, higher exposure is equal to higher risk. When we say schizophrenia, we are talking about much more than stress or overthinking. In this condition, a person may start hearing voices when no one is there, sometimes like someone talking to them, sometimes voices discussing them, sometimes even giving commands to kill themselves. These experiences feel completely real to them. They may also start believing that others are watching them, following them, or trying to harm them, even without evidence. Along with this, they may become withdrawn, lose motivation, and show less emotional expression, and have difficulty organizing thoughts. Gradually, their connection with reality weakens. This can affect studies, work, and relationships. Sometimes people stop functioning the way they used to. And so the key is vulnerability here. Not everyone who uses cannabis gets schizophrenia. But individuals who are predisposed to schizophrenia, cannabis can act as a trigger. Cannabis can also cause anxiety symptoms, sometimes severe panic, fear, or a feeling of losing control. In some people with repeated use, there can be what we call amotivational syndrome, with reduced drive, less interest in work or studies, and a general drop in goal-directed behavior. Over time, there can also be problems with attention, memory, and focus. And if someone stops after regular use, it can cause irritability, sleep disturbances, anxiety, panic attacks, and a general uneasiness. Cannabis is not harmless and it is unpredictable. So if you are thinking about using it, the real question is, should I take that risk?